Hello, welcome back to the Change Initiative. I'm happy to see that you are here with me today. Today, we will be going over session 4, Dispelling Cancer Myths and Cancer Care Connections. Before we begin session 4, let's do a quick review of session 3. Take some time to answer the following questions. First question: what is overweight and obesity? Your answer should be excess body fat or an unhealthy portion of body fat. The second question: what BMI is considered a healthy weight? Your answer is 18.5 through 24.9. And the last question: what BMI is considered obese? Your answer should be anything over 30. Okay, on page 3, we are going to start by talking about some myths about cancer. We know that there are some misconceptions about what causes cancer, how cancer works, and cancer treatments. We also know that people sometimes have wrong ideas about cancer, and this can lead to needless worry or worse, even hinder good prevention and treatment decisions. We want to help change this. So let's look at some of the most common myths about cancer. Maybe these will even be some you have heard of. Number 1, some people think that cancer is a death sentence, but in the United States, the likelihood of dying from cancer has dropped steadily since the 1990s. 5-year survival rates for some cancers, such as breast, prostate, and thyroid cancers, are now 90% or better. Number 2, eating sugar makes cancer worse. That's false. Studies have not shown that eating sugar will make your cancer worse, or that if you stop eating sugar, your cancer will shrink or disappear. However, a high sugar diet may contribute to excess weight gain, and obesity is associated with an increased risk of developing 13 types of cancer. Number 3, there's always a lot of talk about artificial sweeteners, specifically artificial sweeteners causing cancer. But researchers have done studies on the safety of artificial sweeteners and found no evidence that they cause cancer in humans. Number 4, cancer is contagious. False. In general, no. Cancer is not a contagious disease that easily spreads from person to person. The only situation in which cancer can spread from one person to another is in the case of organ or tissue transplantation. However, that risk is extremely low. Number 5, some people want to avoid cancer surgery or tumor biopsies because they think that it could cause cancer to spread in the body. But it's important to know the chance that surgery will cause cancer to spread from other parts of the body is extremely low. Following standard procedures, surgeons use special methods and take many steps to prevent cancer cells from spreading during biopsies or surgery to remove tumors. Number 6, cancer gets worse if it's exposed to air. False. Exposure to air will not make tumors grow faster or cause cancer to spread to other parts of the body. Number 7. Now, this one has been debated for years. Cell phones cause cancer. False. Not according to the best studies completed so far. Cancer is caused by genetic mutations, and cell phones emit a type of low-frequency energy that does not damage genes. Number 8, there are herbal products that can cure cancer. False. Although some studies suggest that alternative therapies, including some herbs, may help patients cope with the side effects of cancer treatment, no herbal product has been shown to be effective for treating cancer. Number 9, this is a big one. If no one in my family has had cancer, that means I am risk-free. No. Based on the most recent data, about 38% of men and women will be diagnosed with cancer at some point during their lives. Most cancers are caused by genetic changes that occur throughout a person's lifetime as a natural result of aging and exposure to environmental factors, such as tobacco smoke and radiation. Other factors, such as what kind of food you eat, how much you eat, and whether you exercise, may also influence your risk of developing cancer. Finally, number 10, someone in my family has cancer. I am likely to get cancer too. False. Not necessarily. Cancer is caused by harmful changes in genes. Only about 5 to 10% of cancers are caused by harmful mutations that are inherited from a person's parents. In families with an inherited cancer-causing mutation, multiple family members will often develop the same type of cancer. These cancers are called hereditary cancers. Moving on to page 7. Now that we are clear about some of the misconceptions about cancer, let's look at why participation in clinical trials matter. Take some time to answer the following question. Do you know what a clinical trial is? Clinical trials are a type of research that tests new medical approaches. There are 5 phases to clinical trials, beginning with preclinical trials. The purpose of preclinical trials is to discover new medicine. It is tested with cells and animals, such as mice. There are no human participants. Preclinical trials research provides detailed information to the U.S. Food and Drug Administration, or FDA for short, about the medicine. The FDA then decides whether the medicine is reasonably safe and then gives permission to test the medicine in humans. On to page 8. Phase 1 clinical trials. Phase 1 clinical trials sees if the medicine is safe. In these trials, there are a very small numbers of patients enrolled. The enrolled patients have many different types of cancer. And in some cases, patients have already tried and failed current treatment options. In phase 2 clinical trials. Phase 2 clinical trials see if the medicine is effective. They look and see whether the medicine works. 25 to 100 patients participate. All of the patients have the same type of cancer, and all of the patients get the tested medicine. Page 9. Phase 3 clinical trials. In phase 3 clinical trials, you want to see, does the medicine work better than what's already available on the market? It must show that enough patients benefit from the medicine and that these side effects aren't too bad. Hundreds of patients are included and use the process of randomization. Randomization. The patients are randomly divided into different groups. One group receives the new medicine and the other group receives the current medicine. Do you know what a placebo is? Placebos, also known as sugar pills, are medications that have no effects on the patients. They are used to see the effects of the medication being studied. Most of the time, neither the doctor nor the patient knows which medicine the patient is receiving. Page 10. Phase 4, clinical trials. In phase 4 clinical trials, we ask, what else do we need to know about this medicine? The purpose of this phase is to determine the long-term effects of the medicine and the medicine's safety over time. Phase 4 answers the following question. Do people that get the new medicine live longer? And are there rare side effects that show up after a long time? Many years are needed to answer these questions. Page 11. Now let's talk about barriers to clinical trials. We do understand there are some barriers to clinical trials. Although clinical trials are a great tool in determining the efficiency and safety of the medication, it faces a few barriers. Starting with low patient participation. Fewer than 5% of the adults with cancer, less than 1 in 20, will take part in a clinical trial. This is due to safety concerns, mistrust in researchers, fear that an effective treatment may be withheld in order to test the new medicine, and other restrictive inclusion criteria. Another barrier is the lengthiness of the study periods. It takes 8 years from the time a cancer medication enters clinical trials for it to be approved by the FDA. Another barrier is lack of diversity. Only 5% of clinical trials participants are African American, and only 1% are Hispanic. A few reasons why minorities are needed in clinical trials are the differences in genetic coding, differences in tumor behavior, and more minority participation helps doctors develop medicine that matches their different genetic coding. Page 12. Now we are going to talk about patient navigation and getting the help you need. First off, patient navigators. These are staff members who can work with patients to overcome barriers and understand the medical system. Their support can help patients get the cancer screening and follow-up care they need. What are some barriers that you have faced accessing healthcare? Many people may share similar barriers that you face. Some patient barriers include lack of transportation, lack of care for children or elderly relatives, not understanding why you should get screened, speaking a different language, mistrust of healthcare system, fear of finding out they have cancer, or fear of the screening procedures. Another health care provider to offer assistance to patients is a nurse navigator. A nurse navigator is a registered nurse who has a bachelor's or a master's degree. A few of their roles include providing support and direct contact and serving as a navigator or connector to cancer resources at a hospital or cancer center. As you can see, with the help of patients and nurse navigators, a team approach is taken when working to provide patients the best care possible. This concludes our last session of the Change Initiative sessions. On behalf of our entire Change team, I would like to thank you for your time and attention. We certainly enjoyed our time with you, and I hope you gained a lot of valuable information that you will share with your family and friends.